Why does love hurt so much? And can a relationship work without attraction? Everything you wanted to ask about sex, but didn't. Now you can ask Dr. Lee, a sexual health expert and associate professor in the Department of Health and Human Performance. Here she is, Dr. Leah.
Thanks, Derek. It's great to be here with all of you today. I'm Dr. Leah Janine. We're here to answer your questions about sex and relationships. We have a lot of the latest research and a little common sense. Plus, we have a special guest here to reveal how patients can overcome sexual dysfunction. But first, let's take some viewers' questions.
Absolutely. Well, here we go. Dr. Leah, a man says, I can't ejaculate when we have sex standing up, but other positions work. Is there anything I can do because my partner likes those positions?
Well, standing up while having sex may be challenging, but it can lead to new sensations. Why not start standing up, but then when you feel like your excitement's starting to build, move to the bed or another position where you can climax. Sex doesn't always have to be about penetration. Try masturbating standing up, or have your partner give you oral sex in that position until you feel comfortable that you can climax with your partner.
This next question is kind of there's a song back in the 60s called Love Hurts. It's still pretty popular today, and it has to do with this question, okay? A viewer asks, why does love hurt?
Well, there's actually a lot of science behind this. When a person falls in love, there's a release of chemicals and hormones in their brain. Some of them cause physical or emotional changes, such as a racing heart. An increase in dopamine helps people falling in love. It makes it feel pleasurable, where a decrease in serotonin soothes the fear of them falling in love. Plus, neural pathways in your brain may make you ignore negative emotions like fear or social judgment. This can result in jumbled feelings of both positive and negative emotions. It can be painful when the exciting and the pleasurable feelings you have for someone wear off, or if they're not reciprocated. Research shows that the same area of the brain that's associated with physical pain also activates when a person is rejected. So that's part of the reason that love hurts.
Yeah, I've been rejected. What should someone do if they're hurting from love?
Well, if you're in pain because of love, you need to pause and analyze the relationship. Remember, all relationships have their ups and downs, but if it comes to the point where you're in pain and unhappy, you need to decide what you want for things to change or whether or not you want to end it. And please, if you feel like you're in an abusive relationship, please seek help. There are resources that can help, like the National Domestic Violence Hotline, which is 1-800-799-SAFE.
Our next question says, the man says, my penis seems bruised after we had sex and it's been a few days. Should I be worried? I would be.
Well, your penis could be bruised, catching it in a zipper, bumping into something, or rough sex. They're all some common causes. If you're on blood thinners, just like the rest of your body, your penis can bruise easily.
Maybe it's just a bruise, but what some of the other causes for this?
Well, even though your penis doesn't actually have a bone, you could have broken it, right? The ligaments and the tissue that make up the penis can be overstretched and bend, causing bruising, swelling, and a deep purple color. If your penis is broken, you probably heard a popping sound with a sharp pain and deep discoloration. Penile fractures usually require surgery, so if you think it's broken, go to the ER right away.
Ouch, a broken penis. That doesn't sound too pleasant. Could anything else cause discoloration?
You might also have an allergic reaction to a medication, antibiotics, or pain relievers like ibuprofen or acetaminophen. They can sometimes cause a purplish rash. Or it could be caused by purpura, which is a rash of purple spots caused by small blood vessels leaking blood into the skin. Getting it on your penis is usually a result of an autoimmune reaction. If what you are seeing is a purple sore on your penis, you could have an STD like herpes or syphilis. If so, definitely go see your doctor and get tested. Some sex toys, like penis rings, can trap the blood to make the erection stronger, but they can also cause a strangulation of the penis. If so, that requires immediate medical attention. Bruising on your penis can be a sign of a serious health problem. Some conditions that affect your blood's clotting ability, like bruising or other illnesses like liver failure or congestive heart disease, can cause fluid to overload in your body, and that could make your penis and scrotum swell.
Dr. Leah, that's a lot of possibilities, from serious to no big deal. How do you tell the difference, and how do you know when to see the doctor?
Well, when in doubt, go see a doctor. You definitely want to play it safe. You don't want to take risks with the penis.
No way, definitely not.
Still to come on Sex Talk. Sexual Protection 101. Improving sexual dysfunction. managing a breakup.
Using condoms can help prevent STIs, but did you know that there are other sexual barriers to protect yourself during sex?
When it comes to sexual health, protection is key. Sexual barriers serve as valuable tools in preventing the transmission of sexually transmitted infections, or STIs, and unplanned pregnancies. Condoms are the most well-known and widely used form of sexual barrier. Made of latex or polyurethane, condoms create a physical barrier that prevents direct contact between sexual fluids, reducing the risk of STI transmission and unplanned pregnancies. With various sizes, textures, and flavors available, condoms offer versatility and enhanced sexual pleasure for all genders. Finger cots, often made of latex or nitrile, are small protective coverings that fit over the finger. They serve as an excellent barrier method during digital vaginal or digital anal play, reducing the risk of STI transmission. Finger cots can be especially useful for individuals who engage in manual stimulation or prefer to incorporate their fingers into intimate activities. Dental dams are thin, flexible sheets typically made of latex or polyurethane. They act as a barrier during oral genital or oral anal activities, providing protection against STIs. Dental dams create a physical barrier while allowing for the pleasurable sensations of oral stimulation. They're available in various flavors, making the experience enjoyable for both partners. To ensure the effectiveness of sexual barriers, it's important to use them correctly and consistently. So use them as intended and be sure to get the correct size.
It's so important to use these correctly, otherwise they may not work. Still to come, a doctor reveals how he helps patients overcome sexual dysfunction. And could your underwear be causing issues down there? That's coming up.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about sex talk. Go to askdrleah.com.
Welcome back to Sex Talk. Today we have men's sexual health expert who's chief of urology at Baptist Health South Florida, Dr. Daniel Martinez. Thank you so much for joining us.
Thanks for having me.
Today we are talking about sexual dysfunction, and that is a general term that can be intimidating. So how do you describe sexual dysfunction to your patients?
So sexual dysfunction, really, first I think you have to define the act of sex, right? And so for a man, as a men's sexual health expert, it all starts off with desire. So you can have some dysfunction with the desire portion. Then once you start initiating the act, you have the erection, so the penis being able to getting hard and staying hard. You have the orgasm, which is the violent contraction of the muscles in the pelvis, and you have the ejaculation, so the part of the actual fluid that comes out. So any sort of sexual dysfunction can involve any of these aspects on this in this entire act that is sex.
In your experience, is sexual dysfunction a common concern with your patients?
Not only is it common, I think it takes number one on their priority list. Let's face it, sex is important, and probably the single most important reason the guys will come see me, forget the fact that they're waking up 10 times a night to go pee, forget the fact that they feel a lump on their testicle, is because they are having difficulty having intercourse with their partners. You could cure a guy of cancer and they'll tell you thank you, but you give them the ability to be able to have intercourse with their partners again and have sex again. Now that takes a whole different level of appreciation. So yeah, I think this is a very important topic that brings a lot of guys out of the woodworks and actually allows them to be able to start seeing doctors for potentially other reasons too.
That's wonderful, and I'm glad that they're feeling more and more comfortable, since I know a lot of men can be a little bit nervous about seeing a doctor. So we know that age is likely to link to sexual dysfunction. What other types of people are more likely to deal with sexual dysfunction?
Sexual dysfunction is a wonderful window into the overall health of a man, okay? And I say that because in order for a man to be able to get an erection and maintain an erection, the stars have to align. And unfortunately, yes, as aging men, we will start to notice that the erections are not going to be as strong as they were, and you're going to start to notice changes into the sexual dysfunction. But as we get older, we can also develop diabetes, high blood pressure, high cholesterol, plaque buildup in the arteries all over the body. we start taking medications, we start developing hormonal abnormalities, and all of these things will play a part in sexual dysfunction and potentially cause. It's usually not just one thing, it's a multifactorial problem.
Okay, so we know that a lot of it can be both physiological and psychological, but when should someone go to see a doctor?
I think the moment they feel they have any issues or concerns. There's a lot of overlap, and a lot of people talk about psychogenic erectile dysfunction. You get these 18-year-olds that I'll see that are presenting with issues getting or maintaining an erection. They're very healthy. A lot of people tell me it's in your head, it's in your head, it's in your head. But what does that mean? There's actually something physiologic happening there. When somebody gets anxious and nervous, your body produces epinephrine and cortisol. These are fight or flight hormones. These are hormones that allow us as animals to survive stressful situations. These are things that if somebody puts a gun to your head, it lets you get ready to fight or to run. And so there's an organic issue there, and we can treat that, and you treat it like any other physiologic reason for having erectile dysfunction. So if you have any issues or concerns, I'm talking to those guys out there, you go get checked.
Can you talk us through how exactly you help a patient? What should they expect when they come to you?
So the first thing you gotta, and it's as you said, it's a little tough for guys to go to the doctors, and this is a very touchy, very taboo, very personal issue. So the first thing you gotta do is, you can't be shy to go see when you're at the urologist's office. What I tell everybody, can't be shy with a urologist. We approach it from a very professional standpoint, a very personal standpoint. Every man will have a full workup in the sense of history and physical. So we sit down and get a full history because we have to know everything that could potentially be affecting here. We also discuss any other doctors that they may not be seeing. If I'm the only doctor seeing them, they got to be seeing also primary care at the very least. We do a full physical exam. Again, can't be shy with a urologist. We have to take a peek under the hood.
Well, thanks, Danny. Stay with us. We'll be right back with more Sex Talk.
Still ahead on Sex Talk. Can thong underwear cause infections? Is sexual attraction necessary to start a relationship? Managing a breakup. Using sex toys safely. Protecting yourself against HIV.
Back here on Sex Talk, now let's take on some more questions from our viewers.
Dr. Lee, I don't think we've ever had a question like this before, so that was the first one. A woman says, whenever I wear thongs, it seems like it causes more odor and discharge, but other underwear is fine. What is happening?
Your thong may be changing the pH level of your vagina. Most thongs are made of synthetic material or lace instead of cotton. That makes it difficult for your skin down there to breathe, and it causes extra moisture. That in turn can lead to the buildup and growth of bacteria, and it can change the pH balance. If you notice a change in the smell of your vagina odor, that's probably a sign that it's caused by bacteria. If you're also experiencing irritation and itchiness, that could be the material or even the thong's design. The string touches the sensitive parts and can cause friction, resulting in inflammation. And another potential problem with the design is that fecal bacteria can move more easily from your rectum to your vagina, possibly causing a UTI or bacterial vaginosis.
Dr. Lee, is there a way to prevent this, or do they just have to stop wearing thongs? For example, can they go commando?
Well, yeah, so I mean, you can wear wider underwear, but a lot of women don't like having underwear lines. So I'm a big fan of commando, just let everything breathe.
Free, hey, just be free.
Exactly.
Okay, any dangers of going commando?
Well, chafing, right? So if you're wearing really tight jeans or any other clothing, that could be an issue, right? Also, if you're wearing a really short skirt and sitting down, you could be susceptible to outside bacteria going up there. But I mean, no more so than if you were nude sitting on a hotel couch.
Nude sitting on a hotel couch, okay.
I know. I get a little creeped out by hotels sometimes with that, so it always amazes me. Like, they don't wash the comforters every time, so just keep that. That's true. So like a lot of people want to sit on the bed when they're getting dressed nude. Yeah,
okay. Well, I'll keep that in mind. A man says, I recently met a nice woman through mutual friends. Everything is great, but I don't find her attractive. Are we doomed, or can I do something else?
Well, when you're attracted to someone, your brain releases dopamine and norepinephrine. High levels can make you feel euphoric and giddy. It's an enjoyable feeling, but just because you don't feel that right now doesn't mean that you won't down the road. So let go of your expectations of love and a relationship. Passion can come over the course of a relationship. You need to stay open to different possibilities.
Okay, so let's help him get into the right mindset. What can he do?
Well, try not to focus on the negatives of the relationship, but look at the positive. By just looking at the negatives, you might be missing and not appreciating what's good in the relationship. Focus instead on cultivating attraction. Studies show that attraction can build over time, but you have to work on it. Talk about things that you desire and about the person, both physically and emotionally. The more you focus on these things, the better the chance that the feelings of attraction will develop.
So being physical will definitely help. So should they have a physical connection?
I would say go slow on sex. Holding off on sex will help your attraction and sexual connection grow. If you have sex too quickly and it doesn't live up to your expectations, it might send you in the opposite direction. So give it some time and accept that it might not happen. If after a few months your feelings haven't changed, this relationship may just not be right for you. But I really think this depends on the person. There are many celebrities and many people I know that there are couples that started off as friends. But for every person, I think it's different. For every person that I really cared about, I knew instantly. And I have tons of guy friends and nothing's ever grown into anything with chemistry there.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about sex talk. Go to askdrleah.com.
Dealing with a breakup causes a range of emotions. You're practically dealing with a loss of a relationship, but taking care of yourself can set you up to be better off.
Breakups can be emotionally challenging and life-altering experiences. Whether the end of a relationship was amicable or filled with heartache, it's important to prioritize self-care and adopt healthy coping mechanisms during the healing process. Take care of yourself. Give yourself time to grieve and surround yourself with a strong support system. And find ways to enhance your physical and mental health, like rediscovering your passions and hobbies. Use the time to reflect on your relationship and lessons learned. Setting boundaries can also create a better space for healing. Consider no contact so that you begin to fall on your friends and family for support rather than your ex. Focus on the future and the possibilities it holds. Surround yourself with positivity and affirmations. Remember that a breakup is an opportunity for personal growth, self-discovery, and the chance to create a brighter future.
And give yourself some space. If you say no contact, resist the urge to reconnect with your partner. Take advantage of your newfound singleness. Now let's take on some more questions.
Dr. Leah, we get a lot of questions about sex toys. And here's another one. Avira wants to know, is it okay to use vibrating toys for anal sex?
Yeah, it's okay to use vibrating toys for anal sex, but please make sure you clean them thoroughly before and after, especially if you're also using them in the vagina. Not doing so can lead to the transferring of bacteria all around your partner's bodies. If you share a toy with a partner with whom you usually use barrier protection, you can run the risk of getting an STI. So you definitely want to be careful.
So could somebody just use a random item instead of, let's say, a sex toy? Is that recommended if they find something they like?
No. Using a random item instead of a toy can lead to bigger problems. So stick with something that is made for that use, like a sex toy, right? There's plenty of anal vibrators available, as well as other sex toys that are made for anal sex. There's various types of plugs as well. You can get sets that start off small, medium, and large. I mean, there's a lot of different ways that you can play there. But again, I want to stress, not switching anything from the anus to any other orifice.
Keep that in mind. Absolutely. Great advice. Dr. Leah, a viewer says, the guy I am dating is HIV positive. How likely would I be to get it, and what can I do to be safe?
Well, there are a lot of factors that go into how likely the risk is that you could be infected. In addition to the type of sex, a high viral load can lead to a greater risk of transmission. If you're a woman and have an STI, the risk of exposure can be up to 8 times as great. The risk is greater if the man is uncircumcised or if the woman is menstruating. Brushing your teeth or flossing, especially if it causes bleeding before oral sex, can increase the risk. On a separate note, if flossing or hard brushing causes bleeding, you really need to see a dentist. The bacteria that can infect the gums that causes gingivitis is often why you're bleeding, and that could also travel to blood vessels elsewhere in the body, and it leads to inflammation, damage, tiny blood clots, heart attack, and a stroke may even follow. So incredibly important to go see a dentist if you have these. If you're randomly bleeding from your arm, you wouldn't ignore it, but people ignore their oral health all the time.
You know, I've heard that before. Even just flossing could give you a heart attack for, not flossing or whatever, bad dental health.
Yeah, your dental health has led to a bunch of other cardiovascular risk factors, which is pretty surprising, but it's really crucially important, and people often ignore it because they're scared of the dentist. But remember, it could lead to all sorts of other issues.
Absolutely. Keep that in mind, viewers. So what about the type of sex you have?
Well, the risk of HIV increases over multiple exposures. So obviously, a person who is exposed to HIV more often has a greater risk of HIV transmission. The risk of transmission with anal sex is up to 18 times higher than with vaginal sex, and the risk is higher for the person being penetrated.
18 times higher. Can medications prevent it?
There are medications called PrEP. They reduce the risk of getting HIV through sex by about 99% and through injection drugs by 74%. However, PrEP is less effective when not taken as prescribed, and it only protects against HIV. So use a condom to protect yourself from other STDs.
Great. Dr. Leah, this next question, I hope the husband's gonna watching this show, and especially this question. A woman says, whenever my husband and I have sex, it feels good, but only he finishes. What can we do to make the experience more equal?
Sex is not only one of the most pleasurable experiences for men and women, but it's also an expression of intimacy and caring. It should feel good for both partners, and you should be able to experience an orgasm too. So let's first look at some of the reasons why you might not be able to climax. If you've got low confidence in the way your body looks, or you're worried about extra fat or saggy breasts, that can make you feel insecure and unable to relax and get into the mood. Or also think, are you a control freak? Some women feel like an orgasm is a potential threat to their self-control. If so, you need to let it go and realize it's not about losing control, but about allowing yourself to enjoy the full pleasures of sex with your husband. It may even be that you don't like the location. If you're not comfortable in your surrounding and you can't relax fully, try changing locations, if it's in your bedroom, or what a makeover will look like to make your bedroom more comfortable and more sexy.
Is there anything that he could do?
Yeah, it could be that you and your husband are not spending enough time with foreplay. Women usually take longer than men to become fully aroused. Does he spend enough time kissing and cuddling you? Ask him to give you oral sex or use his fingers to arouse you. Tell him what feels good and what doesn't feel so great. So ask yourself, have you reached an orgasm while masturbating? If so, then you know what works and guide him to the right place and the right speed. And even if he climaxes before you do, there's no reason you can't ask him to continue to pleasure you until you finish. Well, that's all the time we have for today, but you can still send in your questions. I'm Dr. Leah Janine, and we will see you next time when we answer the questions you've always wanted to know on Sex Talk.